The Future of Paralysis from a Spinal Cord Injury, presented by Paige, Lann. Today I'll be talking about spinal cord injuries and the future of stem cell research to promote healing. First, let's define what a spinal cord injury is. A spinal cord injury is an injury that leads to neurologic disorder that consists of sensory, motor, and autonomic deficits. A spinal cord injury has 3 phases, with the secondary phase being the most clinically important. Within the first phase, we see the immune response take over, such as the monocytes and macrophages that emit chemical signals such as cytokines and chemokines that trigger programmed cell death. The primary phase is mainly structural damage. However, the secondary phase is important clinically due to the processes and cascades that lead to cell death. The second phase is where we see ischemia, hypoxia, edema, and various harmful biochemical events taking place with the spinal cord. We also see electrolyte disturbances such as an increase in intracellular calcium concentration, an increase in extracellular potassium concentration, and an increase in sodium permeability. The main disturbance we are concerned with is the calcium because of the route it takes that leads to the activation of cell death at the spinal cord. The outcomes of these processes and cascades eventually lead to permanent neurologic deficits. Since neurons are damaged in a spinal cord injury, could the body restore its own neural function? Unfortunately not. Neurons cannot divide or undergo mitosis. This means that neurons do not have centrioles like other cells. Other cells that have centrioles have the ability to divide and replicate. One approach of many is the research of stem cells as a means to restore neural function. Though there is research, it is important for me to note that the clinical trials are lacking in fully making stem cells a cure-all approach. Ultimately, there is ongoing research in the experimental phase. So what exactly are stem cells, and why stem cells? Stem cells have the ability to self-renew, but they can also differentiate, which means they can transform into other types of cells. To focus in more on stem cells, we're going to talk about mesenchymal stem cells, which can come from places such as adipose tissue or bone marrow. In reviewing research from Masoto and colleagues, mesenchymal stem cells are a source of experimentation for spinal cord injury healing. Through autocrine and paracrine effects, mesenchymal stem cells provide tissue replacement. They release trophic factors and substrates necessary for tissue regeneration and anti-inflammatory effects. How this process works is by taking a sample of fat from the belly to be placed in a petri dish. The fat cells and mesenchymal cells separate, and the mesenchymal cells expand in a culture setting until they are multiplied. Once multiplied, they are injected into the lumbar spine, where the cells then migrate to the area of the spinal cord injury. Though stem cells have the sense of regeneration and healing potential, it is important to be proactive and begin physical therapy quickly to enhance the effects of stem cell therapy. A physical therapist of a spinal cord injury patient should be initiating the healing process through physical activity to create more gain for the patient. Research also provides evidence for physical interventions with stem cell therapy. In Masoto and colleagues, they indicate that spinal cord recovery can be more effective if carried out in combination with other interventions such as physical activity. The physical activity is considered a good therapeutic strategy to treat various nervous system disorders. In their study, they proved regular physical activity improves sensory and motor function in rats, which potentially can be translated to humans over time. The results of their study presented that rats that were given mesenchymal stem cell treatment in combination with treadmill testing had the highest step count compared to the rats that did not receive both. The graph presented here is the basal mouse scale comparison among the groups up to 8 weeks after injury. The combined group of mesenchymal stem cell treatment and treadmill treatment showed better locomotor results, and the majority of the rats in this group reached scores higher than or equal to 3.5. We see that the rats that were only treated with mesenchymal stem cell treatment only reached a 2.5 to a 3.0. Their results add to the conclusion for the combination therapy with injuries such as spinal cord injuries. Overall, research for stem cell therapy is still ongoing and is changing every day. The evidence and research presented here are only small steps in the direction the effects of stem cell treatments and physical therapy can have on patients with a spinal cord injury.